The National Health Service is the most precious institution in our country.
And that is why the government is asking the public sector to accept a 2-year pay freeze.
So many staff have left or moved on.
I'm moving to Sydney. The work-life balance over there is better.
Modernising the way we fund students of healthcare, so we'll replace direct funding with loans for new students.
By taking away their bursaries, they're saying, we don't care about you, we don't respect your profession.
When my bursary's been delayed, I've had to take my daughter to food banks.
I'm sorry, Prime Minister, but we have nurses going to food banks at the moment. That must be wrong.
My wage slips from 2009 reflect exactly what I'm earning today.
We recognise the work that the NHS staff do,
but nurses get paid less and less.
The understaffing and the underfunding that's taking place in the NHS, I mean, an A&E had to call in the military the other day to staff it.
We're at breaking point. It can't carry on. The queues on the corridor and the situation that the patients are in.
People not having beds, not being seen to by doctors, it just feels like we're in a third world country, to be honest with you.
Funding's been hammered. 8 years of austerity, is it now? And you know, the fact that more people aren't dying is the one that gets me.
There are not enough people on this ward. There are not enough doctors, there are not enough nurses.
This is a 4-year-old boy, Prime Minister, suspected of pneumonia, forced to lie on the floor on a pile of coats. You refuse to look at the photo. You've taken my phone, put it in your pocket, Prime Minister. His mother says the NHS is in crisis. What's your response to that?
I'm sorry. It's a terrible, terrible photo.
Care for the carers as they care for us.
Many healthcare professionals do not have the full personal protective equipment required.
I never thought I'd be in a developed country, in a first world country, wearing plastic aprons.
Remembering more than 100 of their colleagues who've died with COVID-19.
I did believe that it was necessary to make very painful cuts in public spending in 2010, but in retrospect, I can see that the cuts to social care were in a way the most silent, but also the most devastating.
Can't discharge people from the back end of the hospital, so people needing the long-term care because of lack of community services. That means there's no beds coming up on the acute wards, which means there's no beds coming up on the medical admissions unit.
Ambulances stuck, waiting to hand over patients to hospitals that are too busy to take them.
Putting 50,000 nurses on our wards.
The number of nurses leaving the profession in England has hit a record high.
I cannot recruit Band 5 nurses into post. We don't want to strike, we want fair pay, fair conditions and better services for patients.